sorry. Okay, let's get into it. Hello, hello, hello. You guys already know what day it is. So you already know what time it is. It is NCLEX Jeopardy Thursdays. Hey, 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 hey. All right. Y'all saw that. Y'all almost went down. Hello, everybody. Happy Thursday. How are you doing? Let me get myself situated because you can't hear me? Stop playing. Can y'all hear me? Stop. Don't say that. Don't make me upset. Y'all can hear me, right? Give me a thumbs up if you can hear me. Oh, thank you. Okay, perfect. Don't scare me. All right, y'all, it's NCLEX Jeopardy Thursdays. All right, so y'all know that on Tuesdays we have our pre-nursing ACITs, entrance exam, Jeopardy review. And on Thursdays we have our Thirsty Thursdays. No, I'm just kidding. We have our NCLEX Jeopardy Thursdays where we go over everything for the NCLEX and like your nursing school exams, but and definitely NCLEX, okay? So you guys already know if this is your first time, welcome. If you are a repeat offender, welcome back. Hey, hey, hey. Awesome. How are you guys doing today? How was your week? How's your week so far? We got one more day and then it's Friday. Y'all, we got one more day and then it's Friday. Okay, so just hold on. The weekend's almost here. And if y'all watch Love is Blind, the reunion is tomorrow. That's what I'm waiting for. Are y'all waiting for it? If y'all watch Love is Blind, put your hands up. Please let me know if you put your hands up. Drama, right? Season 1 was better, but season 2 was definitely more drama. Okay? But yes, let's go ahead and pull up our Jeopardy for today. Now you guys know that we have our 5 categories. Let me tell you guys the categories for today. Let's do this one. All right. Ooh, this is a good one. All right. So these are our 5 categories for Love is Blind. Love is Blind on Netflix? Y'all don't know? A nurse was putting down an LPN again. Oh, gosh. I'm slick glad I missed that because my Scorpio has been in rare form and my mouthpiece has been, listen, lethal, okay? I can't. I cannot. All right. So these are the 5 categories for today. You guys know, I'm going to show you guys our screen. That's our screen. That's our NCLEX Jeopardy. Okay, just like regular Jeopardy, blue screen, you have your 5 categories, and then you have your 5 questions per category. So we're going to have a total of 25 questions, just like regular. Each week we do a fresh set of 25 questions. I get those questions and I remix it from a whole a load of different sources. A lot of you guys ask, like, what are my books and stuff that I use? That's my library right there. That's LPN and RN stuff, okay? So when y'all be asking me, is it LPN or RN? This a proof, PN, and RN, okay? And this isn't even the most updated version. The other updated versions are my room. All right, so NCLEX and PN, that's why I say, if you are RN or LPN, you can come to this review because you're going to need it too. All right. So our 5 categories, dosage calculations, pediatrics, mental health, fundamentals, and adult health / med surge. Those are going to be our 5 categories for today. Oh, I want to show y'all something real quick. Speaking of LPNs, one second. I'm going to show y'all my new hat. Wait, you go this way. This is my new hat. Wait, make it cute. I just put that there. Yeah. So I don't know where I'm going with this 1941 hat. I don't know where I'm going with this, but I just like the LPN part because period. All right. So let's go back. Y'all know I put on for my LPNs, period. All right. So let's go ahead and get started. Wait, let me get myself together. Jesus. Okay, let's go ahead and get started. You guys tell me what you want your first category to be. I'll let y'all pick the first category. First category. All right, so we have, once again, dosage, calculations, pediatrics, mental health, fundamentals, or med-surg. What do you want our first category to be? And then I'll pick the points. All right, so while you guys are picking, I'm gonna let you guys know. All right, so this is how we play NCLEX Jeopardy. Okay, I'm gonna read the question. I'm gonna read the answer. All right, I'm gonna read the answer choices. I'm gonna let you guys get a chance to obviously listen and answer. You're gonna answer in the comment bar. Because this is Jeopardy, you gotta answer it Jeopardy style in order to be considered a winner. All right, so you have to actually put what is in the comments and then your answer. So if the answer, it's always gonna be 1, 2, 3, or 4. The way we do NCLEX Jeopardy right now, we don't have selects all that apply. So it's all just one answer. It's just multiple choice, I mean. So you're gonna put what is and then 1, 2, 3, or 4, whatever the answer is gonna be. Quick tip, most of my people, my veterans know, quick little an easy thing you can do is just put what is in the comments and just copy and paste it so you can save you a couple seconds so you're not sitting here, what is, because you won't win. These people are fast, okay? And with that being said, let me say this now, okay? Even though we are playing for prizes and incentives, that's just to make this fun, okay? And to motivate you and to really make it really fun. But the actual prize is if you get it correct. Because on the NCLEX, it don't matter if you use what is, it don't matter if you first or not, as long as you get the answer correct, that's all that matters. So this is a review, but we are playing for prizes, okay? We're playing for our top 2 winners. All right, top 2 winners is going to win a study kit, any study kit that they would like from our digital study bar. Boop, boop, boop. Okay, our nursing school study bar. They can go and win any study kit they would like in this study bar. That's going to be our 2 prizes for tonight. All right, so with that being said, once again, I can only go by what is on my screen. Everybody has different screens, different connections. I can only see mine. Okay, so if for some reason there's some type of like lag and what you see on your screen is different from what I see on my screen, and maybe somebody answered first on your screen and it's different from what I answered first on mine, I can only go by what's on mine. So just in case there was like a little lag, it's okay for a question, just answer again for another question. It literally can be anybody's game. You have all the opportunity to win all the prizes, okay? I do these literally every Thursday. So if you don't win today, it's okay. Especially because that's not the whole point. As long as you're actually learning from your mistakes, learning from all the wrong answers that you're getting, and knowing why the right answer is the right answer and why the wrong answer was the wrong answer, that's the true, okay, point of NCLEX Jeopardy, okay? I want you guys to increase your comprehension, but in a fun, motivating way. So that's why we do it in an NCLEX Jeopardy way. So with that being said, let's go ahead and get started. Do y'all have any questions for me? You have any questions for me? If not, let's go ahead and get started, okay? If you have anybody that is studying for the studying for the NCLEX, maybe somebody has a mental health exam coming up, a fundamentals exam coming up, dosage calculations, pediatrics, a med-surg exam coming up, tag them in this live so they can go ahead and get their review. It's a fun review, and it's free, all right? We'll do this till about 8 p.m., and then when we're finished with this, we won't be able to get through all 25 questions, but all 25 questions will be on the free app. The app is The Nurse Sam, free for iOS, Android. Just search it in your Apple Store or App Store, or you can go to the link in my bio and go to that page to download the app. 100% free. When you go into that app, The Nurse Sam, hit NCLEX Jeopardy, you'll see NCLEX Jeopardy Prep, and then you'll see the mobile NCLEX Jeopardy, the ones that we're playing. So after we're done with tonight's questions, tonight's live, these same questions will be uploaded to the mobile version. So you'll be able to play all the rest of the questions, well, all 25 questions, but including the questions that we did, to review the questions that we did, and to finish off the questions that we didn't get to do. So no matter what, you get 25 questions for review. You'll probably get about 10-ish during our live, but if you want to download the app, you'll get your full 25, all right? And we get 25 different questions weekly. It's your free review. Practice, practice, practice is always the best way to review for any type of nursing school, whatever. That's always my best motto, so that's why we do these weekly, okay? So let's go ahead and get started. All right. I didn't see any questions, so let's get started. All right, first thing we're gonna do, first category is going to be fundies, fundamentals, and we're gonna do that with 300. Let's do that for 300 points. Fundamentals for 300 points, guys. That is what we are playing for. I saw somebody else saying, do I do ATI T's tutoring? I do on Tuesday. Tuesday is for T's. Thursdays are for NCLEX. It's the same every week, okay? Boop, boop, boop. All right, so let's do fundamentals for 300. I'm about to read the question in 3, 2, and 1. All right, so a client with active tuberculosis demonstrates less than expected interest in learning about the prescribed medication therapy. The nurse assesses that this client may ultimately need which intervention as a last resort? 1. Directly observed therapy. 2. More medication instructions. 3. Involvement of family in teaching. Or 4. Reinforcement by the primary healthcare provider. What is our answer? I'm going to repeat that one more time, okay? A client with active tuberculosis demonstrates less than expected interest in learning about the prescribed medication therapy. The nurse assesses that this client may ultimately need which intervention as a last resort? 1. Directly observed therapy. 2. More medication instructions. 3. Involvement of the family in teaching. Or 4. Reinforcement by the primary healthcare provider. Which intervention is going to be our last resort that the client may ultimately need? All right, that answer is going to be, drumroll please. What is 1? Oh, where's my YouTube? Where's my music? Hold on. I don't got it. Whatever. It's what is 1, guys. So the answer is what is 1. Let me go back up into my screen. Okay, I'm going all the way up to the top to see who said what is 1 first. All right, let's see who said what is 1 first, okay? And the first one on my screen to say what is 1 is Cresol. Hey, Cresol. Congratulations, and you welcome to the scoreboard. All right, so Cresol is the first person on the scoreboard, and you have 300 points. Like I said, we're playing for our 2 highest point winners for the prizes, okay? So Cresol, you're on the scoreboard with 300 points. It can be anybody's game. Like I said, the points range from 100 to 500 points. So you can just come in at the end and get like a 500 pointer and already be on the scoreboard, all right? So that's the magic of this game. It's super fun. It can go in any direction. All right, so great job, Cresol, for getting that. Everybody else that got what is 1, I'm about to shout you out because you got it correct. You may not be first, but that doesn't matter in the real life as long as you got it correct. All right, so Yaja, I see you, boo. Congrats, you got it. E-Love, congrats, you got that. Kelly Finch, Cutie Ash, Smile Z, Nika Beauty, Dark Skin Melanin, ew. Awesome job, guys. Great job to all of you who got what is 1. If you didn't get what is 1, that is okay. That's another reason why we do NCLEX Jeopardy, because we're going to go over the rationale so that we all understand why the answer is what it is, okay? So this says tuberculosis is a highly communicable disease that is reportable to the local public health department. This agency has regulations that may be enforced to ensure compliance with tuberculosis therapy. Ultimately, the client may be required to have directly observed therapy to reduce the risk to the public. This involves having a responsible person actually observe the client taking the medication each day, because you're not about to play us. You're not about to play us and then be a risk to the public. You're not about to do that. Just because you're less than interested in taking the medication, you're not going to be a risk to my health and the public's health. Okay, so we're going to assign somebody to directly observe you. Take the pill. Let me see under your tongue. Open your mouth. Okay, great. Directly observed therapy. All right. This involves having a responsible person actually observe the client taking the medication each day. All right. This is going to be our last resort and what the client may ultimately need to make sure that they are getting the medication therapy they need, not only for their health, but for the health of the public. Okay. Because remember, it's highly communicable. All right. So great job to everybody that got what is 1, and good job, Cresol, 300 points. All right, that is question number 1 already down. Let's go ahead and go to our next session or category. Let's do let's do mental health for 100. Mental health for 100, because why not? All right, so the nurse is assessing a client who was admitted 24 hours ago for a fractured humerus. A fractured humerus. Which finding should alert the nurse to the potential for alcohol withdrawal delirium? 1. Hypotension, ataxia, hunger. 2. Stupor, lethargy, muscular rigidity. 3. Hypotension, coarse hand tremors, lethargy. Or 4. Hypertension, changes in level of consciousness or hallucinations. Which finding should alert the nurse of the potential for alcohol withdrawal syndrome? All right, so once again, the nurse is assessing a client who was admitted 24 hours ago for a fractured humerus. Which finding should alert the nurse to the potential for alcohol withdrawal delirium? 1. Hypotension, ataxia, hunger. 2. Stupor, lethargy, muscle rigidity. 3. Hypotension, coarse hand tremors, lethargy. Or 4. Hypertension, changes in level of consciousness or hallucinations. What is going to be our answer? All right. Do, 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 do. All right. The answer is what is 4. What is 4? Great job, guys. I'm seeing a lot of what is 4. So let me go ahead and scroll all the way up to see who got what is 4 first. First person to get what is 4 is Charleston Body Shop by Cynthia. Hey, boo, welcome back. Haven't seen you in a couple weeks. Where you been? Where you been? Charleston Body Shop by Cynthia. All right, you on the scoreboard with 100 points. Great job. Congratulations. All right, so number 4 was hypertension, changes in level of consciousness, and hallucinations. All right, those are going to be the findings that will alert the nurse to the potential for alcohol withdrawal delirium. Okay, so shout out to everybody that got what is 4. Even though you weren't first, you still got it correct, and that's all that matters. So Charleston, we know you got it first, and you have your 100 points. Great job, boo. Nika Beauty, I see you. Kelly Joe, Kelly Flint. Okay, all my Kellys getting it. Kelly Joe and Kelly Finch. Janice, hey boo, hey. E Love, Miss Mina. Is that Erica? Meta? Stay like a man for finals. I feel you, boo. All right, so once again, great job to everybody that got what is 4. Hypertension, changes in levels of consciousness, and hallucinations. Let's go over the rationale. So it said symptoms associated with alcohol withdrawal delirium typically include anxiety, insomnia, anorexia, hypertension, disorientation, hallucinations, changes in level of consciousness, agitation, because they cannot get the juice, fever, and delusions. Those are going to be our alcohol withdrawal delirium symptoms, okay? Great job. Let's go ahead and go to our next question. Let's do pediatrics for 400. Ooh, this is a good one. I love these. Okay, pediatrics for 400. I love these because I did a study kit on it. So if you have the study kit, if you have the, do I have it over there? The immunization study kit, like the fast food one with the pediatric immunizations, then you should have this. Damn, where is it? It's gonna bother me. This little study kit, you guys remember this? It's gonna give you the pediatric immunization schedule. It's the fast food immunization one, the one that kind of looks like McDonald's. Yes, that one's one of my favorite ones. I love that. All right, so if you have that, pull it out if you need to, because I'm about to ask this question, and hey, it is what it is, okay? So the nurse should expect to administer the first dose of measles, mumps, and rubella, or MMR vaccine, at which age? 1, 2 years. 2, 4 years. 3, 12 months. Or 4, 22 months. The nurse should expect to administer the first dose of the MMR, or measles, mumps, and rubella vaccine, at which age? Is it 1, 2 years, 2, 4 years, 3, 12 months, or 4, 22 months? What is going to be our answer? Let me pull out my study kit to see what. I honestly can't find it, so. Let's see what our answer is. I'm gonna let y'all answer really quick. Nah, that's lost. I can't find it. It's gonna take way too much time. All right, our answer is, what is 3 12 months, aka 1 year? All right, 12 months. Okay, that is going to be our answer. What is 3 12 months? That is going to be the age in which an infant receives the first dose of the MMR vaccine. Okay, it says the first dose of the MMR vaccine should be administered at 12 to 15 months of age. The second dose is administered at 4 to 6 years of age. Okay, so let's go ahead and see who got what is 3 first. Let me scroll to see which one of you got it. So who got what is 3 first? Erica Mena. Sorry, I don't mean to call you Erica Mena. But Miss Mena, Miss Mena. Yes, ma'am. All right, so you are on the scoreboard with 400 points and in the lead. See what I mean when I say it can be anybody's game? Someone can just come in and get like a 500 pointer and already be in the lead. Well, that's what's happening with you, Miss Mena. Miss Mena. Are you annoyed when people like call you by that name? Let me know. I won't do it no more, I promise. All right, so congrats again, Miss Mena, for getting what is 3 first. Everybody else that got what is 3, Monica, even though you didn't get what is 3, that is okay. You still got 3, which obviously on the NCLEX you would have got it correct. Because this is NCLEX Jeopardy, remember you have to put what is in order to be considered first. So just a little reminder for you. But congrats, you did get it for you did get that answer correct. Smiles, you got it correct. PhD in Scrubs. Boop, 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 boop. Where are you? Yep, Monica, Lynn's A, Phoenix Rising, Charleston. Okay, you studying for these. You must be studying for these finals, ma'am. All right, so congrats to all you guys that got what is 3 correct. Once again, the first dose of MMR vaccine should be administered at 12 to 15 months of age. The second dose is administered at 4 to 6 years of age. If you struggle with pediatric dosing or pediatric immunization schedules and trying to remember what vaccine should be given when and all those stuff, make sure you download the actually you need to download the study strategy workbook, because is it in there? I believe that's in there. It's a freebie. It was a freebie for a little while. Let me know if y'all want me to put that freebie back up. I do believe it's still in the study strategy workbook. It's actually gonna bother me, so let me actually just make sure. So the study strategy workbook that I have for free in the link in my bio, it's 35 pages. Comes with, does it come with the immunizations? No, it does not come with immunizations, but the immunizations are in the Ultimate Nursing School bundle. So if you need the pediatric immunizations, make sure you get the Ultimate Nursing School bundle, because it is included in there, okay? So let's go ahead and go to another question. let's do dosage calculations, y'all. Go ahead and get out that scrap paper. Get them pens, pencils, Apple pencils. Go ahead and grab them out. Get your scrap paper. I'm about to grab mine. Go ahead. All right, this is dosage calculations for 500 points. 500 points, okay? Go ahead. I'm going to give y'all some time to get y'all stuff together, all right? For anybody that's just coming in, remember, we are doing NCLEX Jeopardy. This is our free, fun NCLEX review for LPNs and RNs. Okay, we about to do this dosage calculation. I know y'all don't like it. I know, but that's why we're doing it. That's why we're doing it. So let's go ahead and get this party started. All right. Now this one is fill in the blank. Okay, so there's not going to be any answer choices. So this one's fill in the blank. Let's see who get it. Let's see who get it. All right. The primary healthcare provider's prescription reads vitamin B12. I'm not saying that cyanocobalamin. Cyanocobalamin. I can't say it. Whatever. Vitamin B12. All right. So the primary healthcare provider's prescription reads vitamin B12, 150 micrograms by the IM or intramuscular route. The medication label reads vitamin B12, 100 micrograms per milliliter. The nurse prepares to administer how many milliliters to the client? You don't have to worry about me. You do not have to worry about me. Now y'all know. All right, I'm going to read that one more time, okay? This is one of those like doses, what you have on hand, one of those, like D times H over V, one of those. So the primary healthcare prescription reads vitamin B12, 150 micrograms by IM route. The medication label reads vitamin B12, 100 micrograms per milliliter. How many milliliters is the nurse going to prepare to administer to the client? Blank milliliters, fill in the blank. What is going to be our answer? I need you to round it to the, I don't think you need to round it, so never mind. You don't need to round. Let's look and see who's going to answer our answer first. Wait a second. Hold on. All right. And the answer is, what is 1.5 milliliters? What is 1.5 or 1.5 milliliters? That is the correct answer. First person to get that was CM Booth. Awesome job, CM Booth. You are on the scoreboard, and I think you're in the lead. Yes, ma'am. You are in the lead, too. Where are you? C.M. Booth. Congratulations. 500 points on the scoreboard for you. Let's see who else got what is 1.5. Amrita, Sandy Ambitious. Ooh, future ER nurse. I just said future nurse. Forever Desiree, E-Love, Phoenix Rising, Juju Beans, Cutie Ash, Kelly Finch, Nika Beauty. Boop, 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 boop. Did you get the answer right? I'm shouting out those who got the answer right, boo. I don't see you. I'm going to shout you out anyway because you want. Hey, Monroe Paris. What's up, boo? Welcome to NCLEX Jeopardy. All right, so the answer is 1.5 milliliters. Let's go ahead and break that down. All right, so you guys know that we use the formula in calculating the appropriate medication dosage. In this question, it's not necessary to perform any conversions because what they asked for is exactly what was on the label. They asked for 150 micrograms, and the label read was in micrograms, so we didn't have to convert from milligrams to micrograms or anything like that. So this one was super easy. Okay, so let's go ahead and do it together. Okay, so the prescriber prescribed vitamin B12, 150 micrograms, right? The label is vitamin B12, 100 micrograms per milliliter. Okay, I don't know why that mattered, but whatever. Yeah, 100 micrograms per milliliter. So now we have to figure out how many milliliters. Okay, so now we're going to set up that equation. You guys know that desired wait, I'm confusing myself. Desired, what's the formula? Desired over have in the volume. I'm confusing myself. D over H. There we go. It was D over H times V. That's what it is. Okay, so we have our desired. The desired was the 150 micrograms. What we have is 100 micrograms. And then the volume is that 1 liter. 1 milliliter. Okay, so now we're just going to do that. Divide that. That's going to give us our 1.5. These are the same units, so that's fine. We can just carry that with us. 1.5 micrograms per milliliter. Well, this cancels. This cancels, and that becomes milliliter. So 1.5 milliliters. Thanks, because I always thought it was D times H over V. I always got confused, but whatever. It's D over H times V. All right, so desired over have times the volume. The desired 150, we had 100, and our volume was 1 milliliter. So once we did all that math, it equals 1.5 milliliters. Okay? All right, congrats again. If you got that question, CM Book, because you got that correct. Everybody else, majority of you guys definitely got that fill in the blank. So great job on those calculations. A lot of y'all was scared, but y'all was getting the right answer. You see, it's not that scary. All right, so let's go ahead and go back and go to our next question. What haven't we done? Med-Surg. Let's do Med-Surg for 200. Med-Surg for 200. Okay. All right. A client with diabetes mellitus has had a right below knee amputation. Given the client's history of diabetes mellitus, which complication is the client at most risk for after surgery? Given the client's history of diabetes mellitus, mind you, they just had a right below knee amputation. Which complication is the client at most risk for? Most risk for, I said most, most risk for after surgery. Is it 1, hemorrhage? Hey, Vanice, I love you so much. 1, hemorrhage. 2, edema of the residual limb. 3, slight redness of the incision. Or 4, separation of the wounds. I'm going to read that one more again. A client with diabetes mellitus has had right below knee amputation. Given the client's history of diabetes mellitus, which complication is the client at most risk for after surgery? Is it 1, hemorrhage? 2, edema of the residual limb? 3, slight redness of the incision? Or 4, separation of the wound edges? Okay. Now, I want y'all to take into account that this client just had, even though they just had a right below knee amputation, they have a history of diabetes mellitus. Okay, so what is it about diabetes mellitus that is definitely very important that you need to take in consideration? I'm trying not to answer the question for y'all. But just keep in mind that they have a history and a comorbidity of diabetes mellitus. So how is that going to impact the surgery of that right below knee amputation? Okay. The answer is, what is 4? Separation of the wound edges. Separation of the wound edges. All right. First person to get that is Smiles. Hey, boo, Smile 16. Hello, hello. Welcome back, boo. Okay, Smiles, you are on the scoreboard with 200 points. All right, let me go down the scoreboard really quick so you guys know. These are the points. All right, in the lead, we have CM Booth with 400 points. And then we have Miss Mena with 400 points. Did I say 500 or 400 the first time? CM Booth has 500. Miss Mena has 400. Creasol has 300. Smiles has 200. And Charleston has 100. All right, so those are scores from highest to lowest right now. But we still have about 30 more minutes. It could be anybody's game. All right, so great job, Smiles, for getting that first. Future ER nurse, you're right behind her. Fabribu, you were right behind that. Monica, hey, you got that. Awesome job. Janice, Miss Mena, Elove. Absolutely. Poor wound healing, delayed wound healing. Absolutely. Amen. This is the comprehension that I need you guys to have, or the NCLEX needs you guys to have. So everybody that said wound healing was coincidentally everybody that got what it's for. So it says clients with diabetes mellitus are more prone to wound infection, wound separation, and delayed wound healing. All right, because of this disease. All right, it's just what that disease, that's the effect that the disease has on the body. All right, it's just wound healing sucks. All right, postoperative hemorrhage and edema of the residual limb are complications in the immediate postoperative period that apply to any client, not just clients with diabetes mellitus. That's why they made sure they said, given the client's history of diabetes mellitus, which complication is a client at most risk for after surgery. It's not just a general, everybody's at risk for bleeding, infection, blah, blah, blah. No, because of this patient's special circumstances of the diabetes, now what's going to be there, all right, what are they going to be most at risk for complication wise, all right? And it's because of that delayed wound healing, all right? Now, when you think about that and we think about our options, delayed wound healing, is that going to have any bearing on hemorrhage? No. The hemorrhage is going to happen. It's going to be a risk if you have, I don't know, if you wet the bed at night. It doesn't matter what your history is. Like, it's going to be a risk, especially in the immediate postoperative period. So 1's out. 2, edema of the residual limb. Literally the same thing. That's out. Slight redness of the incision. If you cut anything, it's going to be red, okay? Slight redness of the incision is just letting us know that's not giving us anything that has to do with the diabetes mellitus. But that separation of wound edges, okay, that's going to be more prone to this client just because they're not healing. The skin's not healing. That wound's not closing. The wound's not healing. So if the edges are if it's delayed or if it's not healing as quickly, then the separation of those wound edges could possibly definitely happen. That would be a complication that a client with diabetes mellitus would be most at risk for because of that delayed wound healing. Okay. All right. So great job on that one. Let's go ahead and circle back around to our fundamentals for 400. Okay, we are at 400 for fundamentals. The nurse is reviewing the laboratory test results for a client seen in the clinic. The nurse determines that the white blood cell count is normal if which value is noted on the laboratory report. 1. Here we go. Sorry, y'all gonna see this again. All right, these are the answer choices, okay? I'm gonna read the question one more time. The nurse is reviewing the lab test results for a client seen in the clinic. The nurse determines that the white blood cell count is normal if which value is noted on the laboratory report. Is it 1, 2,000 millimeters cubed, 2, 3,600, 3, 8,600, or 4, 13,500? Not us all having the same answer. Let's look and see what the answer is all together. Y'all ready? Ooh, what is 3? Okay. All right, so it says the normal white blood cell count ranges from 5,000 to 10,000, which means, Miss Ma'ams, You need some augmentin or Keflax or something. You got an infection, boo. So normal ranges from 5,000 to 10,000. All right. Values of 2,000 and 8,600 indicate low values, while 13,500 indicates an elevated value. All right. So the 2,000 to 8,600 would indicate neutropenia, which means low white blood cell count. And then this and high white blood cell count would indicate an infection. So I'm sorry, this one. So 3 is the only one. Oh, I said 3,600. Sorry, I said 86. This is 36, not 86 right here, guys. But yeah. So 8,600 is going to be our answer. 2,000 and 3,600 is too low. That's neutropenic. This is normal. This is an infection. Make sense? All right, so who was our first person to get what is 3? Let's look and see. Let me scroll. First of all, I'm going to be shouting out everybody. Let me get some water because I'm going to be shouting out everybody. Hold on one second. So proud of you guys. You guys unanimously got that one. But the first person to get that right was Smiles. All right, Smiles, you were already in the scoreboard with 200 points. You just got another 400, bringing your score to 600 and putting you in the lead above CM Booth. All right, so now you're in first place with 600, and then CM Booth is in second with 5. Okay. Congrats again, everybody else that got what is 3. Amaya, I see you. Future ER Nurse, CM Booth, Unknown Beauty, Miss Mena, Sandy Ambitious, Charleston, Brina, Baby Mama, Amrita, Phoenix Rising, Juju Beans, Fat Prebo, Nika Beauty. Hey. Awesome job. Everybody got that answer correct. So glad that lab values isn't something that you guys are struggling on. But if you are struggling with lab values, the free study strategy workbook that I have in my link in bio, it's a 35 page study workbook that includes some free study kits in there and some free cheat sheets in there, one of which is the nutrition value themed NCLEX lab values. Okay, that's going to make it super fun to try to remember your lab values because it's going to look like a nutrition label. Okay, I was trying to see if I had that, and I don't. That's fine. Free to download. Link in bio. Okay. All right, let's go ahead and go to our next question. We did fundamentals. Now let's do mental health for 500. Mental health for 500. Why are these words so big? No, these words are really big. It's giving my grandma's cell phone font. Like, it's giving extra large. All right. So this says, remember, it was mental health for 500. A client with a history of opiate abuse asked the nurse, why do I crave this stuff? What? Sorry. A client with a history of opiate abuse asked the nurse, why do I crave this stuff so much? The nurse responds, knowing that the client's craving is a result of which factor? 1, development of tolerance for the drug. 2, lack of naturally occurring endorphins. 3, client psychological dependency on opiates. 4, typical abuse pattern for central nervous system depressants. I'll read that one more again. A client with a history of opiate abuse asked the nurse, why do I crave this stuff so much? The nurse responds, knowing that the client's craving is a result of what factor? Is it 1, the development of tolerance for the drug? 2, the lack of naturally occurring endorphins. 3, the client's psychological dependency on opiates. Or 4, the typical abuse pattern for central nervous system depressants. What is going to be our answer? What is going to be our answer? All right, so our answer is, what is 2, lack of naturally occurring endorphins. Lack of naturally occurring endorphins. That is number 2. 1 second. All right. First person to get what is 2 is... Actually, 1 second. Wait for it. 1 second. This that splat. One second. Why doesn't do it? I'm trying. So the answer is 2, but my rationale isn't showing up. But the answer is 2. Hold on, let me look and see who said what is 2. Chriselle, aka Unknown Beauty, got it first. Unknown Beauty. Hey boo, hey, you are on the scoreboard. All right, Unknown Beauty is on the scoreboard with, what was that, 500? Yes. All right, Unknown Beauty, you're on the scoreboard with 500 points, tying you with CM Booth, and also putting you tied for second place with CM Booth. Still, we have Smiles in first place with 600 points, but the answer is what is 2, lack of naturally occurring endorphins. So, Chriselle, since you got that one, can you explain to us why you chose lack of naturally occurring endorphins? And if it's too much to text and you want to come live with me, let me know. If anybody wants to explain this answer and want to go live with me to explain this answer, request. Hey, Brandon, what you got on? Oh, you this that splat. This that splat. All right, so who can explain to me? All right, so all the people that got what is 2, Fab Review, Smile, Sandy Ambitious, and Unknown Beauty. You guys are the only ones that chose what is 2. Can you tell me why you chose what is 2, which was lack of naturally occurring endorphins? Because I'm not going to lie, a real one like me would have put client psychological dependency on opiates. I would have put number 3. I'm just telling y'all, this question, Nurse Sam would have got it wrong. I'm not perfect. I'm not perfect, y'all, but I would have got this wrong. So can anybody tell me why it was 2, lack of naturally occurring endorphins? And also, can anybody tell me what endorphins mean? Can anybody also tell me what's the first movie that you heard the word endorphins in? Where did you learn what an endorphin was? Because for me, I learned what endorphin was way before nursing school. And it was because of a movie. Does it act like dopamine so you crave it? Okay. Okay. That's a good one. It acts like dopamine so you crave it. Can anybody else confirm? If not, okay, that's fine. We can just move on to the next one. All right, let's go ahead and move on. Opiates alter your brain by creating fake endorphins. Yes, those feel-good chemicals released. Is it because they don't have those natural... Not all y'all getting the answering the same thing. Proud mama, proud mama. Yes, so opiates alter your brain by creating fake endorphins, which are those feel-good chemicals. Y'all remember the movie that you... Okay, so if you didn't watch Legally Blonde, all right, endorphins, what was the line? Exercise give you endorphins. Endorphins make you feel good. Happy people just don't kill their husbands. That's where I learned where endorphins from. Happy people don't kill their husbands because exercise give you endorphins. And endorphins make you feel good, okay? And if you have a lack of naturally occurring endorphins and endorphins make you feel good, all right, you're going to crave the opiates even more because the opiates are going to make you feel good. Absolutely. Oh, y'all getting the right answer. All right, so proud of you guys. Great job. Remember, exercise gives you endorphins, and endorphins make you feel good. All right, so great job, guys. Let's go ahead and go to our next question, and that is... pediatrics for 100. Pediatrics with 100. Yep. All right, so pediatrics for 100, guys. The nurse is monitoring a child for bleeding after surgery for removal of a brain tumor. The nurse checks the head dressing for the presence of blood and notes a colorless drainage on the back of the dressing. I'm gonna run that back. All right, the nurse is monitoring a child for bleeding after surgery following removal of a brain tumor. Removal of a brain tumor. So the nurse is checking the head dressing, looking for blood, spots of blood. But instead of seeing this presence of blood, she sees, or he or she sees, a colorless drainage. A colorless drainage on the back of the dressing. Which action should the nurse perform immediately? Quick question, quick little thing. When you see colorless drainage after someone's had brain surgery, instantly, what does your mind go to? Put it in the comments. Whoever gets it first gets 100 points. Colorless drainage after brain surgery? What are you thinking about? What is that? CSF. Absolutely. Absolutely. Okay, anyway. Which action should the nurse perform immediately? So keep that in mind. All right? Now the question said, which action should the nurse perform immediately? 1, notify the surgeon. 2, reinforce the dressing. 3, document the findings and continue to monitor. 4, circle the area of drainage and continue to monitor. Unknown Beauty was the first person to get that, so she got 100 points. 600 to you. So now you have 600 points and you're tied with Smiles for first place. Everybody else that's giving me CSF, thank you, Jesus. I'm so glad y'all, your heads immediately went there, because that's what I need. That's what I want y'all to go. I don't want y'all to go ahead and choose the answer to be CSF, because you don't know if that's what it's asking, but that's what I want to be in the back of your head, so you know what we can do. All right, so the answer is, what is 1? Notify the surgeon. Hello? Derek Shepard? You need to come back. It's a beautiful day to save lives. And you need to come back and save this one, because he or she is leaking CSF all over the place, and it's not cute. Can you come back, Dr. Shepard? All right, over and out. That's what you gotta do. Notify the surgeon. Notify the surgeon. All right, so rationale says, colorless drainage on the dressing in a child after craniotomy indicates the presence of cerebrospinal fluid, CSF, and should be reported to the surgeon immediately. Immediately. Options 2, 3, and 4, which is like reinforce the dressing, monitor, circle, document the findings. Those are fine, but those are not the immediate nursing actions, because they do not address the need for immediate intervention in order to prevent complications. Because leaking CSF all over the place isn't cute, and it's not normal, and that needs to be addressed immediately. Okay, so you don't want to go to your computer and be like, patient's leaking CSF. We'll continue to monitor. Blah, blah, blah. You're not going to do that first. You want to call that surgeon first. Intervention first, okay? Call up Dr. Shepard and tell him, come on. I know he died a couple seasons ago, but he got to come back. All right? All right. Great job. Wait, who's the first person to get what is 1? Let me see. First person to get what is 1 is Kelly Finch. Hey, Kelly. Welcome to the scoreboard, boo. All right, so Kelly K. Finch was the first person to get what is 1. So you are now on the scoreboard with 100 points. Awesome job, everybody. All right, who else got what is 1? Unknown Beauty, Future OER Nurse, Beautiful Av, Baby Mama, Sandy Ambitious, Snazzy. I remember those CSF from Dr. Shepard. Me too, honestly. There we go. Thank you. All right, perfect, guys. Now let's go to adult health for med surg for 400. Med surg for 400. This one's a diet question. So if you have the Nurse Eats, aka the Uber Eats themed study kit, this would be a great time for you to pull that out. It's the one that, like I said, it looks like Uber Eats. It's like that one. And it has the foods that are high in whatever. But yeah, Nurse Eats. If you have that, go ahead and pull that out. All right. All right. So let's go ahead and proceed with the question. Adult health for 400, but it's diet. Okay. A client with cirrhosis is beginning to show signs of hepatic encephalopathy. The nurse should plan a dietary consultant to limit the amount of which ingredient to the client's diet. 1. Proteins. 2. Calories. 3. Minerals. Or 4. Carbohydrates. A client with cirrhosis is beginning to show signs of hepatic encephalopathy. The nurse should plan a dietary consultant to limit the amount of which ingredient in the client's diet. 1. Proteins. 2. Calories. 3. Minerals. Or 4. Carbohydrates. All right. There's so many moving parts to this question. There's so many moving parts. Let's see if we can dissect it. Let's see if we can dissect it together. I'm going to be asking all these questions, okay? All right, so let's go ahead and answer the question. The correct answer is, what is 1? Proteins. All right, protein's going to be what you want to limit in the client's diet. First person to get that. One second. Kelly Finch. All right, Kelly Finch, you have another 400 points added to your score. So now you have 500 points, and you're tied with CM Booth for second place. You see when I say it could be anybody's game? All right, so let's go ahead and break this question down, everybody. So Kelly got it. Sandy Ambitious got it correct. Nika Beauty, Charleston, Unknown Beauty, Miss Mena, Fapperview, Maddie, Monica, and Snazzy. Awesome job to everybody that got 1 or protein. So rationale says, well, actually, sure, no, I'll just go ahead and explain it. So ammonia is formed as a product of protein metabolism. All right. Now, with clients with hepatic encephalopathy, they have a high serum ammonia level. Okay. So if they already have a high serum ammonia level, that does not need to go any higher. So in order to prevent any type of more ammonia being added, you want to avoid anything that could possibly break down into ammonia, aka protein. All right. The metabolism of protein is a product of, it's formed as a product of protein metabolism. So in order to prevent that ammonia from being formed, you prevent protein from being consumed. All right. So you limit the intake of the protein to eliminate the risk of that ammonia being formed by that protein being broken down. All right. Now that high ammonia level is what's responsible for all those symptoms that you see in a client with hepatic encephalopathy. Can anybody give me a sign or symptom of somebody that has hepatic encephalopathy? What is a sign or symptom or manifestation of a client that has hepatic encephalopathy? How do you know, like, what symptoms that high ammonia level is going to cause what kind of symptoms? What kind of symptoms are you going to see based on those high delirium? Okay, it's the loam. So that's honestly the first thing you notice, that change of mental status change. Yep. Decrease LOC. Absolutely. They'll be talking to you fine and straight 1 minute, and then the next minute they're asking, yo, quick little story time. I had a patient that had hepatic encephalopathy, and at the time I didn't know, but I was talking to them right before I went to lunch, and when I came back, they was talking all types of craziness. Like, they were the norm. They were like in their 30s. It was completely fine. Like, I think we was talking about, like, I don't know, The Bachelor. I don't remember. But when I came back from lunch, they were talking about, like, snakes on the ground. Like, there was horses in the window. Like, they were out of bed. And I was like, so do you have a UTI or what's going on? But, like, that ammonia level was high and was starting to cause a lot of symptoms. So quick little, so some symptoms of hepatic encephalopathy caused by that high serum ammonia. All right. And it also depends on the stage. All right. We're going to have mild confusion, agitation, irritability, decreased attention, lethargy, or disorientation. Their appropriate, or their behavior is going to be inappropriate. They're going to be like their level of conscience is going to be decreased. So they're going to be like arousable, but they're not going to really be as aroused as they usually are. Their speech is probably going to slur, obviously confused, and then sometimes afterward, especially towards the end, or the higher that serum ammonia goes, the more aggressive they become. Okay, so all that confusion, agitation, that turns into aggression. All right, so those are some of the symptoms of hepatic encephalopathy caused by that high serum ammonia. And once again, ammonia is formed by protein metabolism. So that's protein is going to be what we will not be giving them in their diet. Okay. So once again, if you have a patient with hepatic encephalopathy, their diet is going to be no protein or limit protein, whatever. No protein, limit protein, whatever. So make sure you write that down. All right. And then the rest says it's not necessary to limit calories, minerals, or carbohydrates because that has no bearing on the ammonia. All right, so great job, guys. All right, let's do one more. What do y'all say? One more question? One more question. And let's do mental health. I lied. Let's do fundamentals for 200. All right, a client is scheduled for oral cholecystography. For the evening meal prior to the test, the nurse should provide a list of foods from which diet type. 1, liquid. 2, fat-free. 3, low protein. Or 4, high carbohydrate. All right, a client is scheduled for oral cholecystography. Oral cholecystography. That's going to be the procedure, all right? Now, for the evening meal prior to the test, the nurse should provide a list of foods from which diet type. Remember what they're getting, an oral cholecystography the next day. So what type of food, or what list of food from which diet type are you going to give them a list? So 1, liquid. Do you need liquid diet for oral cholecystography? 2, fat-free. Do you need a fat-free diet for oral cholecystography? 3, low protein. Or 4, high carbohydrate. What is going to be our answer? Oral cholecystography. Okay, and our answer is, what is 2? What is 2? Fat-free. What is 2 fat-free? It's going to be our answer. And the first person to get that was Kelly K. Finch. Congratulations, boo. You are on it tonight. All right, so now you just got 200 points added to your score, bringing you to a score of 700 points. Awesome job. Who else got what is 2 or fat-free? CM Booth. Okay, now, I don't know if y'all taking y'all NCLEX anytime soon, but it should be scared of you. It should be terrified of you because y'all are killing it today, okay? Janice, Miss Mena, Fapru, NC Pink Rose, Unknown Beauty, It's Stallone. Awesome job. All right, so the answer once again is, what is 2 fat-free? All right, so rationale says normal dietary intake of fat should be maintained during the days preceding the test to empty bile from the gallbladder. That's what I wanted you guys to note, that it was that cholecystography. I wanted y'all to note that cholecyst and note that gallbladder, okay? So we know we are doing a test on the gallbladder. A low-fat or fat-free diet is prescribed on the evening before this test, okay? This prevents contraction of the gallbladder. Remember, that's literally what your gallbladder is there to do. So if you're not having any types of fat go through your body, your gallbladder doesn't have to contract, okay? And that's what you want, all right? You don't want it to contract. You're trying to prevent it from contracting because you want it to accumulate in... You want to allow for the accumulation of the contrast substance needed for the X-ray visualization for the testing procedure. Okay, So once again, you're avoiding fat because you want to prevent the contraction of your gallbladder, okay? You want all that to accumulate in the gallbladder because you want that test that you're looking for, that oral cystography. Let's look up what that is. Oral cystography. All right. An oral cystogram is an x-ray examination of your gallbladder. Okay, so it's an x-ray look. Wait, that's over here. It's your x-ray examination of your gallbladder. All right, let me go back to my thing. All right, and so since we're taking an x-ray look of that gallbladder, we want to make sure that that contrast that's needed is able to be, it's still stored in the gallbladder. So in order for that to still be stored in the gallbladder, you need for that gallbladder not to contract. All right, that's it's the same as, it is the exact same thing as not using the bathroom before having an ultrasound. They want your bladder full. They want your bladder full. Okay, so they want your bladder full for an ultrasound. They want your gallbladder full for this picture. Okay, so kind of think of it in that way. All right, that's why they tell you do not go pee before this test. Wait, they tell you to go pee, right? No, yeah, I'm right. Yeah, they tell you not to go pee before an ultrasound for better visualization of everything in there. But they don't want you to empty your bladder so they can get a better visualization. They don't, just like this, they don't want you to empty your gallbladder so they can get a better visualization of the gallbladder. All right, exactly. Okay, thank you. Do not pee. So yes, the answer is what is to fat-free. You do not want to have any fat-free. You don't want to have any fatty foods prior to this exam procedure, this test, this diagnostic test, because it's going to then make your gallbladder contract and make your gallbladder work. And we don't want it to work right now. We just want it to be real cute and still. So let's just skip the fat-free foods. We'll skip the fatty foods for right now so we can visualize it. And then afterwards, we go to McDonald's. Whatever you want. I'm just kidding. Don't do that. But yes, fat-free foods is what you want to provide a list for on the evening meal prior to an oral cholecystography, which is an x-ray of the gallbladder. Make sense? All right, so that just concluded our questions for tonight. All right, so let's go ahead and get our winners for tonight. Drum roll, please. In first place, we have Kelly K. Finch with a total of 700 points. Ooh-wee. Congratulations, boo. All right, and then in second place, we have Smile 16 with 600 points. All right, that's our first and second place winner. Kelly K. Finch, you are first place with 700 points. And then Smile 16, you are second place with 600 points. All right, so Kelly K. Finch and Smile 16, congrats to you guys. Congrats to everybody that was on the scoreboard. Congrats to everybody that was playing. So remember, as long as you was getting them answers right, it really doesn't matter if you was on the scoreboard. We do this every week. If you didn't win this week, come back next week, you'll probably win. It doesn't matter. But as long as you're getting these answers correct and getting this practice in, that's really what I want to see. So Kelly K. Finch and Smile 16. Remember, you guys just won any study kit from my study bar. So make sure you go to the link in my bio, check out the nursing school study bar, and look through. I think we have like over 25 different study kits. Go through and see which one you need. Let me know so I can go ahead and send that to you. So send me your full name, your email address to my DMs so I can go ahead and send you the study kit that you would like. Okay. Yes, so Kelly K. Finch and Smile 16. Make sure you do that, okay? Everybody else that won, congratulations. Oh, and Rita, you're taking NCLEX tomorrow. You should not have been on this lot. You should have been at the movies or getting a massage. But congratulations, because I already know you're gonna kill it. All right. Good luck to you. Let me know how you do. All the luck, all the vibes, everything. Good luck. Awesome, awesome. Aw, okay. Smile said she'd like to donate hers to the next person because she won. So that is CM Booth. CM Booth. CM Booth, if you are still on here, go ahead and send me your full name and your email address and what study kit you would like, because Smiles just passed on her prize to you. So great job. That was so nice of you. That was really sweet. Awesome, awesome. So I wonder if she's still on here. If not, I'll reach out. Okay, awesome job. So thank you so much for joining me tonight for another episode of NCLEX Jeopardy. Okay, I always save these lives, and I save these lives, and even though they may not be on Instagram lives, because it's in our vault called the Study Bar. All right, I will be. Oh, I see you, CM Booth. Awesome. Make sure you send me your name and your email and whatever study kit you would like to my DM, and I'll go ahead and send that over for you. All right, so this live will be a part of the Study Bar community, which will be launched March 15th. Okay, you will get access. This is something that I haven't even told you guys about, but I will be telling you guys about it very, very shortly, because 50 of y'all have already signed up for it, and I haven't even really spoken about it, so I don't know how y'all found this. Probably because I wear this. And y'all, yeah, probably, most likely. But yeah, I haven't really even marketed it, and y'all somehow, like 50 people found it and signed up for it. But yes, it is a membership for nursing students and nurses, something that I wish that I had when I was in nursing school. I've been working on this for like a year. Okay, it's a community and membership for nursing students, safe space for nursing students and nurses to come and just talk about everything in nursing. All right. You get it's like a library vault of all the T's, Tuesdays, and NCLEX Jeopardy for the past couple months. You get all the study kits. You're able to access the library of all study kits, all bundles. You won't be able to download it, but you'll be able to, just like in the library, go and open the book, and you can't take the book, but you can still view the information. Like it'll be a library of study kits and all the information, all the fun information that you maybe see, just a vault of that creative, fun learning, and all the videos that we've ever done. Monthly new study kits exclusive to the Study Bar. And I'll tell you guys all the details about this in a post tomorrow. And I'll also be doing some lives and everything like that. And I'll be introducing that stuff to you guys because I'm so excited. I've been working on this for like a year. And so I'm finally so excited to bring this to you guys, because let me tell you, it is a gem. It will definitely be something that you definitely would want, no matter what year or phase you are in nursing school or in your nurse career. Because even after you graduate, it goes into how to, establish yourself as a nursepreneur, if you want to, like how to explore that avenue. Some people don't like bedside, so you get to explore those options and all the content we have with that. Everything finance, especially for nurses. All you travel nurses, okay, getting the coin. You need to make sure your tax information and your finances are up to par. Your credit, everything like that. Y'all need to make sure it's up, it's together. Okay, because the IRS will come after you. So we just have everything that a travel nurse, nursing student would need in order to be successful in their field and in their life. So more to come on that later. But once again, congrats on all the winners. And I will see you guys for another NCLEX Jeopardy, obviously next Thursday. But if you want to come to the Tease Tuesday, I'll see you Tuesday. Okay. If you have any questions, please let me know. If not, I will see y'all next time. Thanks.